Hi, I'm Dr. Jim Collins. Thank you for spending a little bit of time with me. Today I'd like to talk about abuse and neglect in senior care, and specifically the domains and the potential causes of abuse or neglect that can take place in long-term care facilities. And first of all, I want to start by saying that as healthcare professionals, we should all maintain a zero tolerance policy regarding any kind of abuse, neglect, or exploitation of our seniors. I wrote a short article on this. If you'd like some more information, follow the link below to my article posted on my blog. But I'd like to share some very specific information right now and remind all of us about the domains of abuse and neglect. They're very important. And sometimes, we're so busy we forget about them. There are 5 domains to remember. Number 1 is the physical domain of abuse. This essentially involves mishandling seniors, handling them roughly, providing care far too quickly, and most of it might be unintentional, but harm can still be done. The second domain is psychological abuse. This can be verbal or nonverbal, and it can involve threats, intimidation, humiliating a resident, perhaps after they've soiled themselves or they've eaten and they're a little messy, or using any type of harsh language. Those can all be considered psychological abuse or neglect or mistreatment. The third domain is the social domain. This literally involves neglect, not answering call lights, not answering them quickly enough, not taking care of their most basic needs, maybe shaming a resident socially, and exploiting them in any way. The fourth domain is financial. Basically means stealing from our seniors, and that's just a terrible thing. A lot of elderly people live on $40, $50 a month if they're on Medicaid. And to steal money, possessions, jewelry, so on and so forth is just absolutely illegal, unethical. It's just terrible. But stealing, theft, misusing their funds, borrowing money, and not paying it back, we shouldn't be borrowing money from them anyway, or stealing any personal belongings, electronics, or something that might be in their room that's easy to take out. The last domain is sexual. And of course, this is one that a lot of us don't like to talk about. It's uncomfortable to think that a professional licensed healthcare individual would sexually abuse or misuse a senior in a residential care setting. But it not only involves physical contact or behavior, it can also include inappropriate language. Okay? So now I want to talk about some potential causes. I consider these causes and risk factors. I educate a lot of healthcare professionals on not abusing or neglecting seniors. And these are the things that I think are important. Number 1, there are personal causes related to abuse and neglect. That means it's the employee, him or herself, their lack of training, their lack of interpersonal skills. Maybe they don't communicate well. They haven't formed genuine relationships with the seniors that they're caring for, or they've never built trust, a trusting relationship. Those are extremely important. Number 2, psychosocial causes. These causes literally include the environment that the employee is working in. How stressful is it? Is there a culture of negativity? Do the majority of employees not like working there? Are they unhappy and unsatisfied in the workplace? Believe me, unhappy employees are probably more likely to cause abuse and neglect in a senior care setting. Third potential cause, resident characteristics. If the resident has a dementia from Alzheimer's disease or a stroke or something along those lines, they are at a higher risk for abuse and neglect because they might be more challenging, they may have more difficult behaviors, they may be more demanding. And perhaps employees shy away or don't necessarily want to work with that particular type of resident. That sets up the grounds for potential abuse. And the last cause is called organizational. It's organizational causes of abuse and neglect. Working in an overly institutionalized setting is not good. Having high caseloads, demanding caseloads, inadequate staffing, perhaps you can't retain good employees, and a lack of leadership. Those are all considered organizational causes and risks for abuse and neglect to take place. So again, I wrote an article on this, and if you'd like to read it, click the link below. If you're a licensed healthcare professional and you'd like to earn some CEUs, we also have courses on abuse and neglect. So thank you for spending some time with me. I'm Dr. Jim Collins, and I'll see you later.